Well, hello there, Philippine NARS followers. How is everybody? Very well, I hope. And as you know, Philippine NARS is brought to you as a public service project of the PNANV, or the Philippine Nurses Association of Nevada, in collaboration, of course, with PHLV Radio. Can you believe it is already May? I mean, almost half the year is gone. Well, May is a very busy month, and we are celebrating a lot of stuff. Like we're celebrating, May is the Filipino Food Month, it is the Physical Fitness Month, the Older Americans Month, and the Mental Health Awareness Month, and of course we have Nurses Week. So we do acknowledge all of the nurses for all the work that they do for the patients and the community. And we are also looking for ways and means to improve their practice. So one of the proposed ways to improve nursing practice is SB 182. It is a bill proposal for healthcare staffing ratio. Nevada Senate Bill 182 is making waves as it proposes strict nurse-to-patient ratios in hospitals, aiming to enhance patient care and safety across the state. So this bill was introduced in February 5 of 2025. And the bill mandates specific staffing levels for direct care for nurses in various hospital units, particularly in facilities with over 70 beds located in counties with populations exceeding over 100,000. So the bill has received support from frontline workers and faced opposition from healthcare executives. So we have invited today a couple of special people from the SEIU, or the Service Employees International Union Local 1107, right? So to talk about SB 182. So ladies and gentlemen, please welcome Mr. Sam Shaw and Ms. Jody Domineck. Hello.
Hello. Thank you so much for having us. I'm Jody Domineck. I am Secretary Treasurer at SEIU 1107. I'm also a nurse in Las Vegas of almost 20 years now.
Wow.
So thank you for having us.
Of course, of course. How about you, Sam?
Thanks, Doris, for having us. And of course, we just want to lift up all the nurses this week and appreciate all the work that's been done and continues to be done in care, in quality care and patient care. So my name is Sam Shaw, Executive Director for SEIU Local 1107. We represent 20,000 workers across the state. We are also part of SEIU International Union, which is a 2.2 million member organization across the United States, Canada, and Puerto Rico. And so here in Nevada, we do represent healthcare workers, home healthcare workers, and public sector care workers.
So. Okay, home health care workers, you say?
Yep.
I haven't been in there yet, so.
Okay.
Yeah. All right, so I have a few questions for you guys. So you're here to talk about SB 182. So tell us about SB 182, how it came about, and who the author is. Why is it with, you know, why are you endorsing it as a union?
Well, I think it's a very important bill, and Senator Rochelle Wynn is the bill sponsor.
Rochelle Wynn.
She has been a champion for working people, and one of the things that we have seen in this state in particular is that there is a working condition issue, especially in nursing and for our certified nursing assistants, right? And so the conversation is really about addressing those workplace conditions and making sure there's appropriate levels of staff to provide quality patient care.
Correct.
And you know, I think back in the early 2000, maybe 2010, staffing committees were established. So the conversation around staffing ratios has been ongoing for quite some time. There's other states that do have iterations of staffing ratios in hospitals, and we felt like we need to really start having the conversation and really drive the work on that. So that's how it kind of started, and you know, we've seen some great support across the state amongst healthcare workers, amongst union folks, amongst the community, right? And so, you know, we have been really driving home the fact that we need appropriate levels of staff to provide and enhance standards of care for patients.
Very good. So, what healthcare facilities will be impacted if this bill passes?
Acute care hospitals, and like you had mentioned earlier, in population areas of 100,000 or more. Yeah. So it's specifically for hospitals. and acute care
Specifically for
facilities.
hospitals only. Okay. So, what are the examples of the suggested ratios, with these hospitals and the departments?
Yeah, Jody.
Jody?
Absolutely. So it is very acuity based, and also the type of care people are receiving. So that is different in the operating room, in the ER. So we're looking at like the operating rooms and the critical care areas and intensive care areas for 1-to-1. And then that goes to when you're talking about newborns and healthy newborns versus newborns receiving intensive care level care in the NICUs, which we're talking like 1-to-2. And then there's healthy moms and babies after delivery where it's 1-to-6. So it's very acuity based, and also the type of care they're receiving. And these are based on the specialty organization's guidelines. These are very heavily researched on how to guarantee the best outcomes for patients in our community. And these are established as minimums. That always gets brought up about acuity. These are minimums. If a patient needs higher level care, they should get the level of care that they require. So these establish the minimums and always allow for more. But we want to ensure that there is a definitive level of care that every patient in Nevada will receive.
Of course, of course. So, you currently work in the hospital.
I
do. You teach, and you're a pediatric nurse, right?
Yes.
Okay. So, what is the current ratio right now? And as a nurse, why is it important to change the ratio? And you can give examples if you want.
So right now, usually I take 4 patients, but there are times when if there are more admissions, that goes up. And there's not an established minimum. So that can, and that's in my area. In other areas, there have been times where nurses have had 10 patients in what we call a medical surgical floor, 10 patients. And when you have 10 patients, that is 6 minutes an hour per patient. And that's not counting your lunch, that's not counting washing your hands. 1 minute to listen to a heart rate, and your minutes are gone. When do you educate a patient? When do you hold their hand? When do you chart all the things that you did? So that is one of the reasons why we need this. There have been staffing committees that we've had, and the hospital has changed those ratios without input because there was no way to enforce it or to hold them accountable to maintain the safe staffing levels. So what we do have is we have established with those staffing committees a form called an assignment despite objection, or ADO. We love our acronyms.
ADO.
An ADO form.
Assignments
despite objection.
Despite objection.
Yeah,
Okay.
so that's when a nurse doesn't think it's a safe assignment, and they can fill out this form as part of the staffing committees, and they can fill out this form. There were over 6,000 ADO forms completed from only 2 hospitals over 4 years.
Wow.
6,000 times.
That's amazing.
The nurse thought it wasn't safe. So we need to support our nurses. We need to support our community better. So this bill is going to establish a way to make sure that it is safer for everyone in Nevada.
Some examples. When I started nursing, I mean, that was years and years ago, probably before you were born. But anyway, we had 1 nurse's aide and 1 nurse to take care of 10 to 14 patients. And the nurse's aide actually had to take care of the other patients of another nurse. But the care in the hospitals right now is significantly different from before. People are more sick and all that, and the acuity is definitely higher. So I'm glad to hear that, this consideration of ratio is, up there. So I'm hoping that they will consider it. So, okay. So this bill will only impact hospitals, right? What about nursing homes and rehabs? I know they're not, but is there like a plan for it?
I think the first step is addressing the areas that we have seen in the hospitals, right? And we can certainly our hope, just like yours, is that we can move forward in establishing ratios, and then we can certainly explore that in the future, right? But I think right now what we've seen coming out of the pandemic and the increased loads of patients to staff, right, and just the burnout and the frustration and the stress that comes along with all the work that Jody had shared a couple of examples of that, is that what we see through our ADO process is that we are notifying hospitals, right? Nurses are, and saying, hey, this is not safe. And we're not seeing the outcome of that, per se, from the hospital saying, okay, we need to fix this or we need to address that, right? And so I think, we see right now in the hospitals, that's where we want to address it, and we can certainly think about that in the future.
Well, it's a start, right?
Yeah.
It's a start. So, okay, so if this bill passes, will it be mandatory for all hospitals or just the ones where SEIU, the union, is, in there?
No, that's a good question. I appreciate that. No, it's for all hospitals.
It's for all.
It's not just for union facilities, right? It'll impact healthcare workers and nurses and CNAs across the entire state.
Union or not union?
That's right.
Okay. All right. That's good. That's a good answer. So, what are some of the challenges that could occur if this bill passes?
So one of the big ones I see is that we have to be able to have that accountability, because we had very high hopes with the staffing committees that we would be at the table to help make these ratios, and they were changed, they weren't enforced, they weren't upheld. So one of the big things is going to be making sure that we do speak up to maintain these ratios, to keep our patients safe, and making sure we get the education out to all the nurses and the CNAs to make sure that we do follow these ratios once they're established. So we're going to have to make sure we educate everyone in the community about making sure we're able to provide the safe care at these levels, that there is now a safe minimum, and that we do need to make sure that we advocate for our patients to have that safe staffing level.
Okay, so I just had a thought here. What about the smaller hospitals, like in possibly the boundaries of the states, wherein they rely on some patients coming from one state to another, and if the staffing ratio is, enforced, so they will have to, if they don't have enough people to take care of these patients, they're going to have to close that department, right?
So our goal is that we improve the standards, not that anywhere closes. What we've seen is that the hospitals, there are already lots of avenues. When we do have flexible census at times, the amount of patients we're taking care of. So there are already lots of things in place. There are float pool nurses, there's on-call schedules. There's lots of things to already establish to help with the fluctuation in patients. And our goal is that we just improve the safety. This does only apply to hospitals with over 70 beds. So the goal is that, we want everybody to have the safe standards.
Sure.
But the goal is that we start there, because they do have the staffing pool, and they do have these channels and resources, agencies, things like that, to be able to meet the needs of the community. They already have them. Our goal is just to make sure that we maintain that safe level at all times.
Okay. So,
and can I just add just a little bit, because speaking of that, and just a little bit of history too, in 2019, and Jody worked on this too with AB 348, which was workplace violence prevention in hospitals, right? We had a lot of our members and nurses talking about how they're feeling unsafe on the job, right? And so to establish the committee, workplace violence prevention through staffing committees, right? And what you just asked, the only reason I wanted to point that out is that there were some concerns also about hospitals or areas or departments shutting down, and we know that's not true, right? And so we think that in the same vein, right, we know that this is going to help improve not only recruitment and retention, but also provide that standard of care and also the safety that we're looking for all folks, right? Not just nurses, but CNAs and also our patients.
Right. Well, I'm glad you said that, because I know there's a lot of opposition from, of course, the CEOs and the financial people of the hospitals. Why do you think that is, and how do you think we can solve that issue?
I think that this is an upstream issue. We know that we have lots of research on the improvement in patient outcomes, the decreased mortality rate. More patients survive when they get more nurse time.
Right.
We catch complications sooner. We identify changes. We take action sooner when we have more time with our patients. That leads to less cost for the hospitals. We prevent complications like bed sores, like ventilator-acquired pneumonia, and we prevent readmissions by having the time to educate our patients that hospitals don't get reimbursed for. So while this may be an investment and there may be some financial concerns at the beginning.
Right.
However, we do know that hospitals are still making millions of dollars. I don't think this is a financial challenge for any of the hospitals, but it is an upstream thinking and an investment at the beginning with staffing, but there is lots of research showing that it decreases the complications that cost the hospitals money. So while it is an investment, it is one that serves both patients and our community, and ultimately what's good for the patients is good for the hospitals.
Right.
So I think that yes, this may they may need to invest initially, but this is upstream thinking to fix some of these problems downstream. And it saves lives, which is my bottom line. Maybe
That's
not
our
the
bottom
hospital
line. Yeah,
CFO's
that's the nursing bottom line, correct?
Right? Absolutely.
Yeah, and a couple of months ago, my husband was in the emergency room, and we were there for over 24 hours. So I don't know what the staffing ratio was, but they were waiting for tests. They were, and I know that they were busy, but to be in an ER when you already know what's going on with the patient and not get moved up when there were available beds, I think that's a staffing issue.
So that's exactly what the upstream thinking. If we're able to prevent complications, the patient on the unit can get discharged. And if we educate them well, they don't get readmitted, which means there's a bed for the patient in the ER to go to.
Correct.
Which means we aren't holding patients in ER waiting rooms. Right? If we have more people, we can provide more care. And they're saying, we'll leave patients in the waiting room. That's not how nurses work. We're already responsible for them.
Yeah.
We already want to provide care, but if you enable us by giving us enough staff, by staffing us, we're going to provide more care, less readmissions, less complications, more beds, more movement, less time sitting in a waiting room.
Correct. Very good. I like that. So there is a looming question, actually, among healthcare providers, which I'm going to ask you. How can you propose a staffing ratio bill when there is a shortage of nursing and or other healthcare staff?
So right now we are graduating more nurses in the state of Nevada than we ever have. The state has invested in our nursing programs. We have record numbers of nurses right now. What we have are conditions that nurses don't want to work in, conditions that are unsafe, conditions that jeopardize the nurse's license, and their morality when they aren't able to provide the care that they want. We know that there are nurses, we had some testify on the bill, that would return to the bedside if there were safe ratios. There are nurses that stepped away from the bedside because it was unsafe, because they had to walk away from patients. The amount of nurses I've talked to that all have the feeling at the end of the shift of sitting in their car and feeling like they didn't do enough because there wasn't enough time and there wasn't enough of them, to feel like you failed your patients. That is hard. We got into this to take care of patients. So there are nurses, and there are nurses that have testified they would return to the bedside when the conditions improve. So those conditions are improved for the patient, but they're improved for the nurse. So we're able to operate at the highest level and provide the care that we got into nursing to provide. So we know that the nurses are there. I know that nurses leave Nevada to go to other states that have ratios because it's safer for them. It's safer for the patients. They can live with themselves after a shift because they were able to provide care. So we also know that in other states, nursing school enrollment increased when there were ratios. Both people saw that there was a safe career path now.
Correct.
So we It is upstream thinking, but we have to start thinking upstream. The things we've done haven't worked so far. We have to change things in order to have change.
And I agree with you on that note. There is a lot more increased enrollment in nursing schools, but they have not graduated yet. And a lot of people are also leaving the profession on account of this unsafe thing. So there is still a shortage of healthcare. Do you agree, healthcare workers?
I think we are seeing that, but I don't know that we have the exact numbers on the ones that have left because of the conditions that would come back. And I think that we know that we are losing our nurses in Nevada.
Right.
We have to get ahead of that. And if we increase the working conditions, if we make it safer, that's how we start. We have to invest. We have to improve the conditions to get the nurses here. We can't, and the longer we go without these, the longer it's unsafe for nurses in the hospital, unsafe for patients, the more nurses are going to leave. It's going to be harder to get people to want to provide care when they see the nursing conditions. So we have to think big, and we have to invest, and we have to make the change.
Okay, well, it starts there, right?
Yep.
Yeah. Okay, well, thank you for that, Jody. Appreciate that. Now, Sam, tell us a little bit more about SEIU. Which hospitals do you have presence in?
Yeah, we have representation of healthcare workers in University Medical Center, so we have nurses and ancillary staff there. Dignity Health, we have 3 campuses, so that's Siena, San Martin, and Rose de Lima, right? And we have ancillary staff and support staff there. At Sunrise Hospital, Mountain View Hospital, and Southern Hills Hospital, we also have nurses and ancillary staff, and we have just recently unionized our professional workers at Sunrise Hospital last year, and they're actually negotiating a contract. That's physical therapists, that's pharmacists, speech and language pathologists, and then up north we have Renown Regional Center at the main campus, and then we also have Northeastern Nevada Regional Hospital in Elko. So those are the healthcare facilities. In addition to that, we do have in the public sector, we have Clark County, about 5,000 workers there. We have home health care agencies, right? And so we have about 9 agencies that we represent workers there as well. And the Convention Center, Regional Transportation Commission, the Health District here in Southern Nevada, and the Regional Housing Authority in Southern Nevada too. So quite diverse membership from different walks of life and different kinds of roles, in terms of providing quality care and public services to our communities here.
Okay. Yeah, I was more interested. I think this was started by your predecessor, Grace.
Yeah.
The home health. She started talking about it then.
Yeah.
And I'm not in the acute care like you are. I'm, in the home situation. So I was kind of looking forward to see the progression of that. So,
we started, and thank you for really highlighting Grace Vergara-McTall and all the work she did. She was my mentor.
Hi, Grace.
And
miss you.
Yeah, we miss you. And I would say that that started in about 2018 as we started talking about caregivers, right, and the folks that do provide really critical care to some of our most vulnerable population. And through that process of speaking to caregivers, there's about 13,000 home health care workers across the entire state.
13,000?
Right? And we have about, we have one of the fastest growing retiree populations across the country. And, the work that we've done has been in the legislature around home health care in particular is really trying to create a set of standards for the industry, right? So establishing a standards board to really address wages and working conditions, and then also in 2023 we're able to raise the minimum wage for caregivers to $16 an hour. And so that fight continues. We call it a fight because it's one step at a time, just like ratios are.
Right.
And we're really proud of the work, and we're really proud of our caregivers for really stepping up and really driving that work.
That's good. So what are the other benefits of being a union member?
Well, let's hear from an RN that is a member.
So especially for our nurses and our CNAs, we know how to advocate for our patients. We advocate for them all the time. We're really passionate about it. we're not always as good at advocating for ourselves, right? We're a very selfless profession. We take care of other people. We make sure everybody else has their water bottle refilled while we're living off half a Diet Coke. We take care of other people really well.
Yes.
And we don't always make sure and take care of ourselves and our working conditions. So being part of a union has enabled me to advocate for my profession, advocate for my coworkers, change the conditions that affect the patients. And it allows us to have a voice at the table, to be able to come up with these issues and say, we need to make changes. It allows us to work together. And it allows us to improve the conditions for the caregivers. What's good for the caregivers is good for the patients. And it helps give us a voice, because we're really good about taking care of other people. We're not so good at taking care of ourselves. So for me, the biggest part was working with people to help take care of each other. And that's where I've seen the strength that what we can do together. And that has improved the Prevention of Violence Against Healthcare Worker bill. When we worked on that bill, when I started asking about people's stories of violence in the workplace, it was so hard to pick which ones to talk about, because everybody had a story. And that broke me when I had to hear, and how much we hadn't fought together against it yet. So when I saw that, and I saw that standing up and speaking for each other and working together, and that we got that bill passed to improve the safety in our hospitals, to make it safer for the next generation of nurses, that was really what helped me feel empowered, and working with the other union members, that we can take care of each other. And that has been, the staffing ratios, and I've worked on this for several legislative sessions, almost feels like a dream. But we are the closest we've ever been, and now's the time that we can stand together, and this is what happens when we work together.
Yes.
And I think we do that a lot for our patients really well.
But we don't do it to ourselves.
And a union is a group of people working together to improve the conditions. So that's what it's meant to me, is being able to take care of the people working next to me.
Okay, that's really a great answer. And, I don't know what it is with some of our nurses, not everybody, but it's so hard to engage them to become, a little bit more cohesive, right?
I've had this struggle, and the best I've gotten to is we give it all to our patients, and we work so hard that we empty our cup sometimes, and it's really hard to engage in the things that fill our cups back up, because we do give it all to our patients. And I'm hoping that as we improve the conditions, we're going to improve some of that work-life balance. We know that burnout is part of the reason we're losing so many of our nurses.
Correct.
We know that something has to change, because it's so hard to get them to do things to take care of themselves, because they don't have anything left. So again, this is going to be part of that change, to allow them to have a little bit more left at the end of the day for themselves, for the community, to be engaged.
Right.
So I'm really hoping to see some of that improvement with this.
We are too, and I'm glad you mentioned that, because our organization, the PNANV, actually has a self-care program. And so we have developed a booklet, and we have developed classes. I think you have to attend like 4 sessions to promote self-care. So if you can pitch that, I mean,
Absolutely.
we'd be happy to come. I mean, to explain it all to you guys.
Thank you so much for identifying that and investing in taking care of the caregivers, because that's if we care for the caregivers, it's going to ripple out and affect our entire community. So thank you for doing that for everyone.
Actually, we call it me first. Ako muna means you have to take care of yourself before you're able to take care of others, right?
Absolutely.
Right. Okay, well,
Wonderful.
thank you for that. So SB 182 already had a hearing, right?
Yep.
What are the next steps for it to be voted upon and for it to become a law?
Yeah. So typically it goes through a committee. It depends on the Senate or Assembly, wherever it lives. And this was Senator Rochelle Wynn. So it started in the Health and Human Services Committee, and it was heard on March 6th. And from there, it typically will go to the floor of that particular House, so in the Senate, and then it would move to the Assembly. SB 182 does have a fiscal note on it, so what happens there is the next step is to go to a Revenue or Finance Committee, right, for it to be reviewed for fiscal impact, and then it would be voted out and go through its typical process. So right now, that's the next step is for it to go to the Finance Committee, and we anticipate that it will move through that process very quickly because we're less than a month away from the session being done.
Yeah.
And everything's now starting to move very quickly. We do have folks up in Carson City today on another bill that is a priority of SEIU members, and so that's in the Assembly, and it's going to move along through its process too. So, yeah.
Okay. When is it? I think it's a. When does the legislative session end?
I believe it's June 2nd.
Oh, June 2nd?
Yes, I
Wow,
believe.
that's less than a month. You're right.
Yep.
So for anybody interested in the bill, you can email your representatives right now and let them know how important this bill is. A lot of people think it's a nursing bill. It's not. Almost everyone at some point in their life will need care in an acute care setting. This will affect almost every Nevadan. This is so crucial to our entire community. So nurses can speak to it. And if you know a nurse, if you are a nurse, if you love a nurse, ask them. They can tell you how important this is. But this affects everybody in Nevada. So now's the time. We don't have an exact date, but go ahead and tell them now how important this is. You can go to findmylegislator.gov/Nevada.
I think so, yeah.
Just find my legislator, enter your address, and you can click on it right there to email your representatives and let them know how important this bill is.
Okay.
Or you can go to the Nellis website, which is the Nevada State Legislature website. It'll show you, type in SB 182, and it'll show you all the committee members, all the legislators there, and then you can drop a note. There was thousands of opinions on SB 182, and so obviously there's some energy around that in the community, and we are very excited about the progress we've made and continue to be hopeful that we can push forward through this next, 3 weeks. Right?
So I honestly thought that we were done, that we are not going to be able to do anything else, but I'm glad you mentioned that because there is still hope.
Yeah.
I mean, if you call, like Sam and Jody said, you call your legislators anyway, and you can still get your voice heard, right?
Yeah.
Absolutely.
Very good. Well, so what is your message to being Nurses Week, right? What is your message to the nurses and staffing ratios? You already said that, but what's your general message to the nurses?
Well, happy Nurses Week. Thank you for all you do every day. We know that each and every one of you advocate for your patients fiercely. Now's the time to advocate for them loudly. Now's the time to let everyone know how important this is. And we are so grateful for everyone and everyone listening and everyone watching. We thank you, and we hope to improve this for everyone in our community.
Very good. And Sam?
And we're in this together, it's not just about union or non-union, it's for the community.
It's for the community,
raising standards for all caregivers across hospitals and, the folks that have committed their careers and lives to healthcare. And I think, also it being NHPI Heritage Month, I think we appreciate having us on today.
Of course.
And of course Nurses Week, and just really recognizing the tireless commitment from nurses and all healthcare workers.
Yeah. So if you have any other things, in the future, just let us know, and we'll definitely give you the airtime for
all right.
this.
Thank you.
Appreciate it.
Thank you so much.
No problem. And so I really would like to thank you, Jody and Sam, for coming to our podcast today to explain about Senate Bill or SB 182. I know there's a lot of information and there's a lot of things to take in, but in the long run, it's your decision. At least the hearing, it's been heard, so it's now going to go through the legislative process. So we're hopeful, for that. So thank you again. Appreciate it.
Thank you.
Doris.
Okay. And to our listeners and followers, we leave you with this. SB 182 in Nevada establishes strict nurse-to-patient staffing ratios in hospitals, particularly in the facilities over 70 beds. They're located in counties with populations exceeding 100,000. So the key points of this bill are, one, it's direct care nurse ratios in the operating rooms, in critical care units, and in emergency rooms, in the trauma units and such. The other keynote is, the key point is staffing committees. The hospitals are required to establish staffing committees for technical and staff service, which will then, collaborate to develop documented staffing plans. And then the third key point to this is record keeping, that the hospitals must maintain records related to staffing and report certain information to ensure compliance. So this legislation aims to enhance patient care and safety across the state, but it has sparked, like we said, debates regarding its feasibility and potential impact on hospital finances. So the outcome will then possibly set a precedent for similar legislations across the nation. So we're hoping, that it will go through. We will keep you up to date with the outcome. And as Sam and Jody said, it is going through the process. But thank you so much for joining us today. Be safe and be well. This is Doris Bauer, your Philippine Nurse host, signing off for now.